this type of communication not only clears up confusion, but it also reinforces something important, that you are the decision maker in this process. Your providers bring expertise and guidance, but you're the one who knows your body and your goals. And that sense of autonomy, making decisions in partnership with your team, is backed by research too. Are you ready to get back to the activities you love after knee replacement? Well, we're here to talk about what really works. The Total Knee Success Podcast is your trusted guide before and after total knee replacement. Here you'll find practical tips and evidence-based strategies, not personal medical advice, just education, all to help you manage pain, rebuild mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm so glad you're here. Today we're diving into a part of the healing process that doesn't always get enough attention, and yet it can really make or break how smoothly things go. I'm talking about communication with your surgeon and your therapy team. Healing after a total knee replacement isn't a solo project. It's a partnership. Research shows that patients who feel actively involved in their care and communicate regularly with their healthcare providers report higher satisfaction and faster return to function. In this episode, we'll cover how to make the most of your follow-up visits, how to talk about pain and swelling without feeling like a burden, and how to keep everyone on your care team aligned. Because the truth is, good communication is just as important as exercises or cold packs, and it can save you a whole lot of frustration down the road. Before we get into the details, let me share a quick story. I once worked with someone who was making great progress after surgery, but kind of felt torn between two pieces of advice. Their surgeon said they didn't need a cane anymore, while I was encouraging them to keep using it a little longer so we could fine-tune their walking pattern. They didn't want to seem like they were challenging either one of us, so they stayed quiet and felt stuck in the middle. Once they finally brought it up directly, we clarified the plan together. The relief seemed immediate, as far as I could see, and they moved forward with more confidence. And that moment reminds me how much smoother recovery is when everyone's on the same page. So if you've ever wondered whether you should speak up when something feels unclear, the answer is yes, absolutely. Let's talk about how you can make the most out of your follow-up visits. Before each appointment, it really helps to have a short list of questions. So that would include things like, is my pain level typical for this stage? Or when should I expect to stop using my walker or cane? Or how much bending or straightening should I realistically expect by now? Or, what should my range of motion be? What are the numbers? Should I be at 90 degrees or more than that? And having questions ready makes your visits more productive. Patients who asked 3 or more specific questions per visit reported significantly higher satisfaction with their recovery process, according to Wild et al. In a study in 2011. And my tip here is to jot your questions down ahead of time, and don't be afraid to write down the answers or bring someone with you to listen. That way nothing gets lost in the shuffle. Next, let's talk about pain and swelling, because this is an area where clear communication really matters. This is another big one. I don't want you to hold back because you don't want to bother your surgeon or therapist. Use the simple 0 to 10 pain scale and then describe whether the pain is constant or intermittent, if it's sharp or dull, or only shows up during certain activities. And remember, there's no wrong answer on this scale. It's not a test. A 5 for one person may feel very different than a 5 for someone else, and that's completely normal. It's your number. The important thing is that the scale helps your providers understand how you're experiencing the pain in your own terms. And research also shows that the numeric pain rating scale, which is the 0 to 10 scale, has strong retest reliability, which means people tend to give similar ratings when asked in similar conditions. And that makes it a useful tool for tracking your own progress over time. And it also reinforces that the numbers are individual to you. Your 5 may not match anyone else's 5, and that's exactly how the tool is meant to work. Another way to help your providers is by adding a few adjectives to describe the quality of your pain. Words like throbbing, aching, burning, stabbing, Different words that are very descriptive can give important clues about what's going on. It's also helpful to notice how your pain changes during the day. Does it feel sharper in the morning and ease as you move? Or does it build up at night or in the evening after you've been active all day? So sharing these details paints a clearer picture and makes it easier for your care team to help guide you. And when it comes to swelling, it helps to describe both the patterns and the qualities. Does it get worse at night, similar to your pain experience? Does it improve when you elevate or ice? Is it tight? Does it leave an indentation if you press gently with your finger, or does it bounce right back? Just like with pain, there's no right or wrong answer here. Your experience is what matters. And swelling often changes throughout the day, sometimes increasing after activity and easing with rest. Sharing those details makes it easier for your team to understand what's happening and adjust your recovery plan as needed. And remember, your providers can't help with what they don't know. And here's some reassurance. Pain and swelling are a normal part of recovery. For many people, pain and swelling both gradually lessen over the first few weeks and months, though it can take longer for some. It doesn't mean you're doing anything wrong. It's simply part of the healing process. And communicating that is how you can find out, is this normal for you? So staying consistent with your exercises, your rest, and communicating with your team helps guide you in the right direction. Now, let's spend just a moment sorting out what's considered normal after surgery and what might be a red flag that actually needs medical attention, sometimes right away. One of the things a physical therapist can help you with after surgery is keeping an eye out for possible complications. They can help you notice changes during your visits while you track how things feel day to day at home. Working together in this way is one of the reasons having a physical therapist involved after a total knee replacement is really so valuable. So normal signs often include some morning stiffness, achiness after exercises, and swelling that improves with rest, ice, or elevation. On the other hand, red flags might include a sudden increase in pain after you've been making progress, redness, warmth, or drainage coming from the incision, or sharp catching pain or locking of the knee. About 10% of patients experience complications in the first 3 months, and that's from a study by Mont et al. In 2018. Catching them early can prevent bigger problems. So if something doesn't seem right, don't wait. Call your surgeon. They would much rather you reach out than risk things worsening. Another important piece of recovery is keeping your whole care team aligned, so you're not left in the middle of conflicting advice. And here's where things can get tricky. When you're working with more than one provider, you may hear slightly different timelines or recommendations, and that can feel pretty confusing. One of the best ways to handle this is to bring notes from one provider to the next or repeat what you were told so everyone's in the loop. And don't be afraid to ask, who do you want me to check in with about particular changes? Is it you, my surgeon, or my therapist, or both? This type of communication not only clears up confusion, but it also reinforces something important, that you are the decision maker in this process. Your providers bring expertise and guidance, but you're the one who knows your body and your goals. And that sense of autonomy, making decisions in partnership with your team, is backed by research too. And it often leads to more confidence and smoother progress. Of course, autonomy doesn't mean ignoring medical precautions. Safety guidelines exist for a reason. For example, if you ditch your walker before your gait is steady, or you ignore swelling that turns out to be an infection, you may end up with setbacks. Even small missteps can add extra weeks of recovery or make daily activities harder than they need to be. So that's not meant to scare you. That's just meant to inform you. On the other hand, using precautions wisely often shortens the time it takes to feel steady and confident again. So use your decision-making power wisely. Balance that independence with caution. Finally, let's talk about something called the therapeutic alliance. This refers to the trust, respect, and teamwork between you and your providers. And research shows that patients who feel heard and respected by their therapists are more likely to stick with their exercises and report higher satisfaction in their recovery. And what does that look like in real life? It means being open about your concerns, asking questions without fear of judgment, and giving feedback about what's working and what isn't working. Trust me, your therapist wants to know that. I want to know that when I'm working with a patient after surgery. It might look like telling your therapist when an exercise feels too easy or way too hard or maybe quite painful. I often ask people, is this activity or exercise easy, medium, or hard? And that gives me an idea of how they're doing if this is on target for an activity for them. You might ask your surgeon to explain why they're recommending a certain restriction, and that way you can understand why you should be limiting yourself in certain areas. It could also mean sharing when you're feeling discouraged, so your care team can help problem solve or reassure you. When you and your provider see yourselves as partners instead of just patient and clinician, then recovery tends to feel smoother, more encouraging, and much more tailored to your needs. You are an active partner in the process. The effort you put in, the questions you ask, and the honesty you bring to your care all make a difference in how strong and confident you'll become. All right, let's bring everything together. Today, we talked about the importance of asking clear questions at your follow-up visits and how that helps you feel more confident about your recovery timeline. We discussed being open about pain and swelling so your providers have the full picture, and we clarified what's considered normal and what might be a red flag that needs medical attention. And we also explored how to keep your team aligned, why your role as decision maker matters so much, and how building a strong, trusting relationship with your providers makes your full recovery smoother and hopefully less stressful. Here's the takeaway I want you to carry with you. You are in charge and you also hold some responsibility. It's not just up to your providers to tell you everything. You're an active partner in this. Your providers are here to guide and support you, but your voice and your goals are central to the process. And if something doesn't feel right, don't hesitate to speak up. We want you to succeed and to have the best possible outcome, just like you do. If you found today's episode helpful, please subscribe and share it with a friend or family member preparing for a knee replacement. And don't forget to check out totalkneesuccess.com for links to resources and tools you can use at home. Next time on episode 7, we'll talk about getting back to daily activities, things like stairs, driving, and hobbies. Those are big milestones, and you don't want to miss out on doing them when you're ready. And just a reminder, I'll be answering listener questions in future Q&A episodes. If you'd like to submit a question, please go to totalkneesuccess.com and use the question form there. I can't provide personal medical advice, but I will share educational information that may be useful. This podcast is for educational purposes only. Visit totalkneesuccess.com for more resources. Follow the show and share it with a friend. Your total knee success is already in motion.